Yat shas twi Suzani ado ane hanada siyo gizi do di binibi. The modo na kijona na yos kaso kodoshin todizin lini be anani letole. Thank you for tuning in to all the listeners to our weekly town hall. It is Tuesday, and we'll go ahead and start off with a prayer. And I'll go ahead and say the prayer. Kodeho jondole shamana hasanya del hil. Ado tlistan twistan. Charles Hayol Cardinal de Tui H1. Kadadin Anis Anarib Kehojon. The Yajane await ni glon nadi nakodo. Ara creature con nitsudizen. A jashi nike or tlatonike or nil that end. So there's an asa. Be nate leto kodo be yelti. Aro asa anizino kodo. Nike Tahiana the hot etole. Edi nido nizin. Shamana Hassan Yadil. Naka Akoniado le Kona Sambakatni Dahi. Ashine la kon hidden and leaning con. Bejadas del Donits art like Keda Hastin, con the la Nasco net nidget. Sa Bega Honini do yo otnet be Chinsi Kesi. Bega na ini nido le Nasco net nidget. Ado con has twin his zani dan the hon. Ya echo as nas ado le con. Ado con ak aged bita nadi kahi con. Ya echo con hina de yes kato le. Hog as in leaning hon which na ini lo in hin sendole. Ado con da east ido asa anazino con. Bikit lido le con bikit at on lebisit aja. Ba na holiado le. Ha de shinda ke hona nishi kinda ke otai kinda ke. Yat kon bagan has anko yat hatadet edole yat was nahot at ole aro kon ha chinidan leaning arts kon ni to ken hin a liket at that kon yat da kedo aro hashine la kon ni to lot so kon lodo ni da ke edo yat but kon lodo len ni to lot so aro ko ala lange de nishi kon to la is is ni ka kon sesa it's isn't de jai arts Betrayada hot edole ara kon hinat ani lini da asla ana zino kon tila de nat ani lini bida bachine bit on the hon yat hon nada kedole hinat ani dan lini ni beshwas ana tat nas nila arts kon benashni dole ara ot nas anja da ara tat nas in the bitnas ango chapter houses dan ligo aja da inish edo yat but nada has yat Nihil nahot at ole kon aro ishin kon do ya at ehi kon de kos nas at dapedi nini nihit adolto aro ishin kon benahon net monkey pots do ye hon nihit adole kon zagon das li dole kon sabo eya so there's in lini on shende be nana si dole adine ben hich ojanasli Thank you, everyone, for tuning in. And at this time, we'll go ahead and send it over to our leadership, our Honorable President, Jonathan Nez.
Oh, yat shaddo kodon khatsudin zingi la arana kijin da nish kodohan ni chikondeli dinashnigi dashnigi juk adaja hol ji winter so Washington the dol kilti nashni do the kosigi the kosentragi do the kosentragi na hast eitzata hot ya kodo nezel indan lenigi hanet chikunda yili Navajo Nation has aj do Washington Navajo area hika natja edo hanen hichikunda yili do bisl deil nashigi do zel indan ndaz neligi Navajo Nation do benago John Hopkins da gido kodon hika natja cope do aja benan nishidel inigi nich ashanin da yili the monat ya la isha nashni hela bi khida da no da yada tin de Washington da konde jo da ya kon hi ken hi nasa da do na do di ha ishi na nashna ha no monkeypox bi elia do kan khishni the nabi ke ya ka o ka de di go kon hikeni hinne bida dolna so adahne adainolne ada hollado ngalchindo sa kodon hije kondal ingi chashane dalle ado lashi kodo bilagana keche hije hane kondal edo nantinet edo na hatate kodo ashwan hije badeni kielchin nosenigi ni masani hiche ni nalaba hatra ba tra da hoslne do bicha ashane dalle ne saj ado kodo lai hanen hije konde kon shade Dr. Perfilia Fowler ajado the neck etche hije ashane nail so lego da hatne don hista halne do hida hije ashane adel da hat no da yada kodo ye da mona atlo kodon hije ashane del ibn del nishigi so bada halne ashkonsk enoslini do die de kosentragi nast aids da huljegi COVID-19 ayades kidot akonde analni ado di khijena holji show kachi ahne nle hadne gonne shi lahande ikle to lecho a shochen stugo benach eklo de lahande ikle ne ade discussion halleto benach nle hanne gonne ya lahande ikle to lecho da halya don hi maso chudal Shake bedo lich yashtigi bina shmasi na chikuishla do yashtgi do na chikunash lego da hanen hina tani la do be masalon tra da raha no da bada hanne jukudo hanne ni jikundel iho yas aba hazini ye di na chikundel iho ni jigiltje ado dido bindel kidigido edo picture that egishindo nache kundel so e on his thousand dollar do kondo biga hada no da yada tie cha ato ya ishni ha da din de kosentragin hast et ata kodo ya ado da do nene do bata so tie da di no sa be yel tie do koni ki ni masani ki chain nalada bena tiene nasi jo eben nach edo kojini da do biga hajini da ashi ni kon da ni da ashkona ni tsko adasi do ado biga hada di nene elkeje alla andi tleshi di tsko da is nela November bi so eben nach ya ni tsko da nani tle ado tido bikeje inde bahagi jo yisi kon alka nature hado elkinde nishakane Knabi chini ka lik adna kido bala nache akot bikije de party na shnigi so ado ze bahazli kuje monkey pox do de kosentragi na hast aids ata edo hijo but de ini kich eno thin in khada tse flu shot so da halon do left jodi khigo dendel ki ya flugi de kosigi Edo bikijana abagi do bikijana neshigi ze do bahalo flu do monkeypox do COVID-19 what ze badahalo bikijana neshigi ebini na kodo nakhada tseto nakhal shindo ni so ken nalike what ze bije koda net do lesh ashkone da hasya shkeno thini and we come to you on another Tuesday. We're in Herfinune, New Mexico today for a meeting for the water line project from to continue from Nahadeshkis to Crown Point and surrounding communities. So we are gathered here today with some of the officials. We come to you every Tuesday. We apologize for coming on a little later. There's just so many things that we are monitoring right now. Of course, you heard the announcement. I think the president of the United States is kind of stepping back, and I know he said that the pandemic may be over, but it's really not over, right? The COVID-19 is here to stay, but we all know what to do. I mean, we all know what to do. Wear our mask, won't use hand sanitizer. Those same things push back on the flu. We're going into the winter season, so flu shots will be available. And it also pushes back on this new monkey virus that has come into the United States. We do have 4 cases now on the Navajo Nation, and we just want everybody to be careful. It's and for the monkeypox, it's skin to skin, so a lot of touching. So use your hand sanitizer, use the elbows, fist bumps, and use the hand sanitizers as much as you can. And we also want to thank our first frontline workers, our healthcare professionals that are on the call who give you an update. So I said in Navajo earlier that we need to get this information out to all our Navajo citizens, including those of you that are listening to understand Navajo, translating it and remind people out there in our communities. I know Dr. Fowler does an outstanding job in translation. So, take some of that information and share it with your family members, everyone. So again, we're here in Herfanu, New Mexico for a water line project extension. I have our chief of staff here, Paulson Chaco, to say a few words. And again, COVID-19 is here. It looks like it's here to stay. We know what to do. At some point, I think we're going to be lifting all the restrictions because we know what to do, and it's going to be on the citizens to push back on COVID-19. And the government has done an outstanding job, our frontline workers up to this point. So now our citizens really have to continue that momentum. Let me introduce our Chief of Staff here, Paulson Chaco, to say a few words. Thank you, everybody. God bless you, and God bless our great Navajo Nation.
Thank you, Mr. President, and everyone that's on the line as well. As President mentioned, my name is Paulson Chaco. I'm the Chief of Staff for the Office of the President and Vice President. We're here in Herfano, New Mexico, working diligently with several chapters to improve their quality of life by running a water line. And as you probably are well aware, that we have the Lateral Water Line project. It's a huge water project that's coming in from this part of the country, which is from San Juan and getting water all the way down to Gallup. It's the Navajo Gallup water pipeline. And as you drive 491, you probably see all those pipes that are alongside 491 going to Windrock. That's part of this whole project, bringing water to the Navajo people. And and water is one of the main resources that we need. In the beginning, when COVID first hit the Navajo Nation, water was essential in the fight against COVID. And that's one of the reasons this administration has been diligently working to get water to our Navajo people. The project that we have here in Herfano is basically that. We're working with several chapters, Nahodeshkis, Vicente, Little Water, Crown Point, Coyote Canyon chapters to deliver water as well to those communities. So we're going to be working with the community and the chapters to get a water project to those families and those areas, affecting over 500 families. So that's the reason why we're here to assist any way we can to the communities. There's a meeting of those chapters today in Herfano to discuss some of those projects that we're going to be dealing with. So that's why President and I are here in Herfano to support the communities. And as you know, the COVID is not over yet. The pandemic is not over yet. So that's why we still are working on a lot of these water projects. This is only one of many that we're dealing with. There's over several other projects that we're dealing with, water projects such as in ARPA. We have numerous projects that we're working with NTUA, NECA, to deliver additional waters to communities all over the Navajo Nation. So we're hopefully we'll be able to get most of these projects done within the next few months and the next few years, upcoming years. And in addition, today we'll be working with the communities of the other schools as well. We're here to visit with other schools today to see what their needs are. So I will go ahead and give that's the update that we have from Herfinone, Mexico. Shinantai. So, here has Shimako Hashin, so the Zambehoin Zido Hashin, so Kodon cannot ani Mr. President. Nes Kurashin, so the Nashni that he hot beat ato be caught that he hot Hashin, so that he hit Kahol no ebony na at Yado Hashin, so Kodo, Bake Hashin, so Kodo and health workers na Lenny Hashin, so Kichigeta Keto Hashin, so what Kashin, so what अब क्या था नोश शदने हशीं कुत या गिच हस्ती तो ले करे या अहुन सो दिशली तो करो या हनाना जी के शे बनार दिश आल डॉक्टर जिम yeah.
Go ahead, VP.
Oh, okay. Good morning, everybody. Vice President Elijah here. Appreciate the messages from President out in the field, as you saw, and also our Chief of Staff, Paulson Chaco, out in the field. Vital information being given out there and updates being given at the Huerfano area for the water that's coming out from the Cutterell Lateral. So it's all good stuff happening out there, new developments. So as you join us today, it is Tuesday, September 20th. Thank you for joining us. I don't even want to call it a pandemic update anymore. President Biden citing that the pandemic is over, and of course we want it to be over. Varying levels of comfortability out there across the board. Many Navajo still not wearing masks, but we urge you to continue to be safe out there. We urge you to continue to just know your surroundings, and we see our numbers kind of dipping down a little bit. We look forward to you all just continuing to be safe. Of course, we hear from our health professionals here. We appreciate all of the data, and lately it's been a new focus and emphasis on just monitoring the monkeypox outbreak that's happening worldwide and around. So we pray for all of you. Continue your prayers in your own way for your own family and your own region, your own city, your own area, and all ultimately it all is counted towards us as a society, as a membership of the largest nation, Indian nation in the United States. So thank you for joining us. My little segment here, I give updates, and of course. The updates is really just news comprising our region, and nothing new to contribute for the Navajo Nation. You heard, of course, President Nez's portion just a little while ago. In the United States, I believe you heard that President Joe Biden declared the pandemic over. In Arizona, a big shout out to she's still the vice chairman of the Yavapai Apache Nation. Just got an alert from her that she is the chairwoman elect now. So congratulations, Madam Vice Chairwoman Tanya Lewis out there, Yavapai Apache Nation, Camp Verde area. She ran her campaign on incumbent leadership, much to be said about incumbent leadership, with added emphasis on communication and transparency. I believe, especially during a pandemic, her leadership was very apparent there, along with Chairman Huey, all good friends of the Navajo Nations. But a hearty congratulations to her for winning her tribe, her nation's general election. So going forward as the new chairwoman elect, Tony Lewis. So congratulations there. New numbers here, total positive cases, Arizona, 2,264,159 in Arizona. Again, this is in a state just about topping out at 7 million strong in Arizona. So it gives you a good idea of where the numbers are. Apache County, and these are just, update numbers, 31,066. Navajo County, 43,986. Coconino County, 49,418. And these numbers are provided Wednesday, so tomorrow will be new numbers there. Colorado, no new updates, although the total positivity for Colorado, 1,646,785. Again, with daily updates there. New Mexico, Total positive cases 616,125. San Juan County 47,172, and McKinley County 30,245. Utah 1,034,616, and San Juan County, there a little bit closer to home, southeast Utah, 4,610, with our own Utah Navajo health system there checking in on the Navajo Nation, 2,321. So again, we gave our updates, and gave a shout out to Miss Madam Vice Chairwoman of the Apache Yavapai Apache Nation there in Camp Verde, Vice Chairwoman now, but soon to be the new Chairwoman of the Yavapai Apache Nation. But in closing, it's important that we all stay informed, as you know, and that's why these updates, town hall updates, are vital. Giving you information of where leadership is, where the leadership of the nation is, fighting the post-pandemic time. Also, just well-wishing, and as you see, leadership here, praying, advocating, leading, and supporting all of our entities, our divisions, our programs, and our health. I guess health entities out there, IHS and the 638s. We prioritize still hand hygiene and the like, knowing your surroundings, right? We just came through the Navajo Nation Fair with two more to go, large events to go, the Northern Navajo and the Western Navajo, where I'm sure many of you will be gathering. We ask you to continue to be safe, and just be knowledgeable again, and be prepared. Hand sanitizer around, masking up, and if you're in close quarters with a lot of people, which you will be, but it'll be outdoors. So again, your level of comfort and safety and leading your family has been well established up to this point here. So thank you for all doing what you all do. Yeah, God bless you as well as you do that. Stay home when you're sick or exposed to COVID-19. I know many have been kind of challenged with what with all of these the rain, the moisture, then the flowers that soon cropped up, the yellow ones, the beautiful yellow ones, and the purple ones, the beautiful purple ones. I think it was the purple ones though that create bullheads, though, right? Be careful with your bicycles and your motorcycles out there. Just look forward to being able to gather a little bit more readily here as well. But get your COVID-19 vaccine or booster if you have not already. In light of the high contagiousness of the COVID-19 Omicron variant, it's more important than ever for you to be sure that you are adequately protected. So, really, I have a few more updates here, but you're going to hear the same. So, I'm not wishing to be redundant here. Appreciate our health professionals here, led by Dr. Jill Jim, and our epidemiologist team headed by Del Yazzie. Appreciate everything that they've done all of this time, being in harm's way themselves, advocating, and then our nurses, our doctors. You all rock. You all know that, and you all had families to go back to. So again, we've honored them, and we continually thank them. We appreciate it as well given, well earned. It is well documented, and yet we still send our best and our prayers for all of our health responders, our health frontline workers, everybody. Continue to be the best for our Navajo Nation. And lastly, I guess the updates that the Vice President can share with you is the as we open up, is establishing a very firm foot place in this moment in time. Every pandemic in our history has changed the way society operates. We've been working feverishly. We've been working with high levels of leadership from DC, U.S. Department of Energy. You've seen President Nez up there in DC with President Biden. As the new narrative comes out there, where is the Navajo Nation narrative? Are we progressing? Are we pushing forward? Are we looking to relocate companies to our Navajo Nation? We need the jobs. We need to place revenue lost by the closure of our NGS. When you are in a time of this here, when again the temptation and the risk to continually, I guess, have a notion of being closed. When the world is opening, you have to be a part of those discussions, those vital discussions. And, we wish to relocate all of those burgeoning segments that are out there, tribal energy. We're on top of that. We're having meetings with those groups. New consortiums are started up. Other tribes are working together in this time, in this space here, wanting to put the U.S. Department of Energy on notice that, Indian country is open for business. We are, and we wish that they would look at us and all of these new monies. What with the Inflation Reduction Act recently passed here, we're in competition now, but I believe we're stronger, unified together. We're working with other tribes here to bring these large scale energy projects here. And so, again, every pandemic in our history has changed the way society operates. Now is the time we insert the Navajo Nation narrative, the Navajo Nation emphasis, and we notify the world, the globe, that the Navajo Nation is open for business. So appreciate you all. Continue to be safe out there, and we'll see you on the highways and byways of life. May God bless you. And ladies and gentlemen, I'd like to introduce Dr. Jill Jim. We appreciate her exemplary and stellar leadership in helping tamp down, helping control this virus here that we've are still trying to the least of our I guess people out in the fringes, those that aren't getting the information. We continue to advocate for them and help keep them safe. So, Dr. Jim, if you are ready, you are willing and able, we introduce you now.
Thank you, Vice President,
Oh.
for your comments. I'm not in the office right now, so I don't have my video on. So I'm Dr. Jill Jim. I'm the Executive Director for Health, and I'm always just wanting to thank the listeners on the call today, and Vice President and President, and also Chief of Staff that was on the call earlier today, talking about the importance of the health and the well-being of us. I mean, we have been in this pandemic, and now I guess with the words coming from the White House that the pandemic is over, I guess from my interpretation, the pandemic, to some extent, a pandemic is determined by maybe the vast impact to the population or persons across the United States. And right now, with the current vaccines that are available, especially the bivalent Nuvax booster dose that people need to consider taking and checking with your provider to see if you qualify, is very important. And then also continuing to practice mitigation strategies as well. So to some extent, I agree with that, but to some extent, it's still a large public health concern. So just to know that we still see cases. We don't see that much individuals passing from COVID, but we know that it's still an impact to our population more so than the flu. And I know the flu season is going to come up quickly too. So all of these strategies around just the unknown, we don't really have a crystal ball to determine how to plan for the future, but we know that we ought to still consider it a priority to keep each other safe because people are still getting sick. So, and some individuals may not be getting tested either as well if they're not that symptomatic or if they're not that severely sick, especially younger people. And so just to note that it's still very important if you're unsure and you have symptoms, COVID-like symptoms, to still get tested and not just to indicate that it's an allergy or a cold or a flu or a stomach bug, just to make sure that it is very important, especially if you're high risk, to get Paxlovid or other oral treatment for COVID as well. So that this really hasn't gone away. Luckily that we are able to provide additional vaccines through the health facilities to fight against BA.4 and BA.5 with the current booster doses as well to fight against that. So it's very important. We will be issuing out new isolation and quarantine guidelines that are not yet available to the public. So just kind of keep a lookout for that. So if it is finalized, we'll share it next week. Otherwise, just stay safe, everyone. And also with the monkeypox cases, we've reported 4 total cases now, and these are among individuals that have traveled off the Navajo Nation as well. And so it's very important that contact tracing and notification of signs and symptoms of monkeypox is also reported, so that we can also try to get as much treatment as possible or vaccine available to individuals that might be most highest at risk too. So one thing that we did mention is just that to just consider the safety of everyone in the household. Monkeypox can be transmitted very, very close to skin contact as well. So it could be with individuals in your household and you might not be aware of it if you've had an exposure to monkeypox as well. So continue to just be mindful that there are diseases out there that we still need to keep an eye out for, especially during now that the weather is turning cold. And so I am wanting to encourage everyone just to share with your family what you hear on the town hall with others. And then we just do the best that we can to continue to let everyone know to stay safe. So thank you for listening, everyone, on the town hall this morning. I'll hand it over to Dell now with the Epidemiology Center. So I thank the team for continuing to do this. I know we provide daily cases, but I know that once we're moving on to sustaining this and the next phase of the pandemic, I think we'll consider and look at how often we report, but on a daily basis. But we do appreciate the team to reporting every day from all the health facilities as well. So, and thank you very much. Get away, Del.
Okay. Hi, everyone. Okay. My name is Del. I'm with the XUC COVID epidemiology team. I'm here to provide a quick update on our latest COVID numbers for time period September 9th through the 15th. First, I'd like to acknowledge our COVID-19 epidemiology team. As President Nez mentioned, we have a lot of partners that are working with us and helping us throughout this COVID pandemic. Just here from our Navajo Epicenter, IHS, Navajo Area Office, also the THOs, the 638 facilities, and CDC and the CDC Foundation. Some folks are helping us virtually. And then Johns Hopkins Center for American Indian Health, and COPE, and TGen continuing to help us do the sequencing work for COVID. And of course, our state partners from Arizona, New Mexico, and Utah. So I just wanted to acknowledge all of our partners helping us with the epidemiology work for COVID. This is our recent cases and trends graph for over a 60-day period going back to July 18th to September 15th. So as you can see, our daily cases continue to fluctuate, but the orange line is our 9-day moving average. It gives you a better sense of the trend, and we've been trending downward really since the end of August. So that's the past couple weeks, 2 to 3 weeks actually. We've been on this downward trend. So it's a good sign, and a 9-day moving average here. The orange line, we ended at about 47 cases. So again, that's a good sign. Core metrics here, our 7-day case rate here continues to decrease as well. It went to 209 cases per 100,000 people. Again, we are seeing a decrease in cases, but we're for Navajo Nation, that this number, this 7-day case rate, is still pretty high. So we're still seeing a lot of COVID cases on the nation. Percent staff beds occupied by COVID patients is at 2.1%. which is still at medium risk. And then hospital admissions rate is at 1.3 admissions per 100,000 people. That continues to be at medium risk. And the next update will be next Monday. Supplemental metrics here, there were 331 new cases over that 7-day period, which is a minus 39% change from the previous week. And then our 7-day lab-based test positivity is almost at 12%. Again, these home tests are not included. And then our hospital capacity, bed occupancy is regular beds is at 54%. ICU beds are at 70%. They're both below our 80% threshold. So that's good. Vaccine coverage, this is a new update here. There's so the those who have completed the primary series is at 69.1%. However, this new update per CDC, there's a new definition that they came with due to the new, the BA4, BA5 bivalent Omicron, vaccine that's now available. So the up-to-date definition changed. So now it's 4.1% for Navajo Nation. So you are up to date with your COVID-19 vaccines based on this new definition. If you have completed the primary series, which is the first 2 shots, and then received the most recent booster dose recommended for you by CDC. So the new one is the new bivalent COVID-19 booster, which is the BA4, BA5 bivalent vaccine. So and that's for 12 years of age and older. And then people ages 5 to 11 years are recommended to get the original monovalent booster. So there's new definitions and new update for us here for our vaccine rates on the Navajo Nation. And then the COVID strain surveillance, a lot of the sublineages of Omicron have been detected on the nation to date. Again here, the updated Navajo Nation residents only vaccination rates here. Primary series at 129,567 have completed the primary series. And then with the new definition that are, the up-to-date definition, we're back down to 7,585. So as the bivalent vaccines continue to be administered across the nation, this number will continue to increase. So we're now at 44% for up-to-date, 69% for primary series. Epi curves for the entire pandemic for the US in blue line and Navajo Nation in orange, we continue to decrease. Again, that's a good sign for us on the nation and across the US. 7-day case rate here. Again, I mentioned we are on the decrease in cases, but those cases continue to be high number for Navajo Nation, and therefore we are number 3 compared to the 50 states. And as you can see, our bordering states are all with the lesser 7-day case rates across the country. So New Mexico, Arizona, Colorado, and Utah. As pictured here, we haven't seen these colors within our region in a while. I want to say probably going back to like March of this year. These light shaded green colors within our region, the 4 corner states, and the immediate region here are all with these light shaded green colors, meaning with the lower 7-day case rates. Again, that's a great sign and good news for us. However, community transmission remains high. You still see a lot of red here across the country. And within our region, Coconino County is the only county within our Navajo Nation that's orange. All the others are, Apache, Navajo counties are in red in Arizona. San Juan County, New Mexico is red. And then San Juan County up in Utah is red as well. So there's still a lot of COVID transmission going on within our region. The strain surveillance for us on Navajo, the only highlight here, this was updated yesterday, report 67. The only highlight here is really the BA5 sublineage of Omicron went from 433 to 496. There's like 63 new cases that were identified with the BA5. And the BA5 continues to be the predominant variant for us here on the Navajo Nation. So we'll just continue to monitor this. And then just here, this slide here, the upper chart here is all the service units here, continue to participate in the strain surveillance. And then the bottom chart here, as you can see, is the BA5 here, the top row, continues to be the predominant variant to date. And then as far as across the US, CDC variant profile here, and also the BA5 is the predominant variant, making up about 85% of all variants that's being detected across the US. And last, high-risk chapters here. 31 chapters made the list this week. Last week, there were 33 chapters, so this also continues to decrease. Again, that's a good sign for us. And if you go across to the right, all the way to the far right, the red column here, going back 6 weeks, these 22 chapters have been on this list every week for at least 6 weeks. So that's the latest update for our COVID situation on Navajo. And I'm going to stop here and hand it over to Shema, Dr. Fowler. Please take it away. Thank you.
Yeah, she yas do not yeah ade edoshne. Shas twisazani to kitoj a kent the nothing could not that see your gizzy. Ich had nicht do let kodoshe. But nahashnet do let adon himadon hije himasan hinaleda kojapan da akisi she kodo. But nahashnet kodon hinat lini eya yehazi ado eya kodo de kosnas et at tapeti nini pa nahwilne. Do hannet lini hije indel I do nihil ilchan alzani jo edate eshik edoshne. Akodina nehi bit Nan benapin ilyai jo kodo yanan hokan hinat lini tildo shiyaj the president do vice president lini is the lini nakahata net jo benapin the hasni ado ani kodo bachana hot ani monkey pot stick ne do aja is it bahalla ado ditsi ni do the course what yani jo do be is it bahalla okodin hinat ani lini asa ni beda hasdan nan nation lini kodo ni hinat ani alanj tasatani di herfen no da aden jaga de aden dot ni chakhazi ado di kilna tasatani kodo ya taga hatzando ni chahanana zi ko atanje nanish bitske ni idon ha ati kon khana ho ato na khayati kodo ba ni zendo ba ni zi do le shido kodo shiyaj do sitzilin lini ano sa he ado di ajanshi di kode kinahal kaida at ni hits alto da ninde jo ni he ati oyo ati jikish ni hitne kodon hinat ani lini ado na kunne ked atalate na nish ba bilik lani chief of staff ne kodo ala lange ni atalate ni lini ajen hinat ahmle do yanan ho ko adi Katnas na lipis na has ango to aja achano yilde nisto yildagnish. Ado di topait si jo ada ba Allah alle. Jo di kujo highway 491 dik na aja topa od si jo hashin zago nanish. ako ni o yugo inta has beta hosen o konde jo asa na ano chi kodo beta English do ke beta English ako ado ya nan ko kanti na tani lini italate ado besh masa ane ado tatnas litan lini hajo de isno ado tatino sen John Hilne alana kone kerne das tani shiyaj koda akut ya nahne ado ke betadil naida jo ehut ado disani lini da aden hinago na tani nada sli jo edo kehetne ado edo ya nahod na kinal kede alaje hina tani jo pa ide lini jo edi kadna nihi kad nihit alto no ya hadne ado na kone edi shiche en lini aje etalate non kodol ezel ebelhas aj lanj nik igi edin hitsis pa akayani do pa akuyani pa akunitsini kodo yanahne shisazido ani di kwa ejanshi kinah gende ya de lado ni hits alto ninde she yise besazini edi ze benapen ilyaiki jo da holno zel ebelhas ango okoyanan ko kanto ya hen se kon ze na hata yaiki ado shiyajin lini edi kodo nasni nal ka jo adi ya nahalne edi benit anso nas edo shla ata yol kali ye nahalne akoti aje ya halne edi hashine na hil ka neja do an hit edi ida o yunda al kahi nasni nil kahi ye ka anal roi yo troje ado hosto je so lebe zoje ado di bitsi istliji bezel ibnas ango o you ka nature do ilkisidit akoti is tanti chiche ani ya ani do ya gonal ke di benit osenle na kidamoya da aida ya deskina kadyago ayago ilkil Quando ditos chiche wat kako na kidneza tino anas okune la benada dolna akodi zel ebelnahas ango jo ati medium resistne oko ashi na kato hashine la nkitene enlini ati zel ilne yahata ka konde ze bahata na don sabo na stada aro di home test kit nini aho wande na adel kai edi tos chiche edi na kidemilia jo anstran ne tos nezatino anatino anas akune la da ska akonde asla ajin de tad nezatino anas edin akune la da alka aro di benapen iliadi ka ni hanana ni igi tahot ade yotka jode asla apeso be wotka edi kade hastran yalj il ker konel ya ze nhahadalia akonde di inni ze na booster de nene chidokot atin nhahadalia asla apeso be wotka asla soye kode aro di kapenapen talia booster de nini nakachin hiyajin hi away dan lini na kids ata peda hedon le teko pavilion booster de na Asian kodon hiche na dalia zel ingo ben yen na taro lecho kapan pana hotlan booster de nini jashi di asla ha o sido na ki aro tra on kad ti kon na hashine lanshe ishlane ikha jo ze benapene nasi dinas nido ati jikishi benacha an kha da tan hilne ado din hiya ze benapen kha aliaki asla nezatina natino anas 8 million do asla nezatina satino atos akone la ze lini kha talia konda art endek at ze nkhatalia tin de tsin ze nkhatalia tos de media jan stad nezatino at sebetino astla akotik at very inni hanana ne adequate at chipi raha atla apeso beotra akodon khanatalia kondishik edo shidne yese Bechana inil nido le yego ye kido ati ya kilit adolto einitzen akodi islatin kahot zonihin na gopelko di ni hit na ka zoge ati tane I ka konde ni hina go yo todo hos tojido de pensa do so le ye gon leo yatna dal kit ko ba he ni tsin ado di Tlaho and or nil di niniki Omicron variant BA4 and 5 that all tai etos dino ashla nits up at degonades kit jo HAO that did not open up and that na jo eben nutchet ya an ni ako ado di tatnas nibas anko adito ya kit at that did na et sena pa with na ita na din do ba so Sena bahuilne katino asla ot enet katnas libnas ango kat enatino atus ako ajato dibe yago nades kid ako anhi ni ad eyashik edo shidne adon hit so the zin here or in jashin adat end ba here needs in corona hat so the zini ado kadatin da hit so such ado not so the hit adito ze ben ha the question is that after HAO here he need ole do be kid do kid ya just kid that he don't need go sang he at the ho oba here winsen kodo president do vice president na hatsedilsen creature so that ilsen ko eba here needsen halati ein hits adult do ein needsen jo oda akwiliat eya a jashi kinahal kede at naho at sa da nin de jon he ko jo o ta si ti do at ta hui yani e ben na hon hi di ne at sa atin hi chi don hi ze ta do de spal na ha kun ne o de e na ho ko len da a ko jon hi nen hi na tani do ze ik en a yisen na cho ko do ni de jo ti ye go ya at za go ye go ne at za go jo a de shi e na ho do ni ta ti na konde jo an hito jo be ta hui lia da do be na ni kinda ko hon wa de so tani ha jo be na kin ni ke masanin ke che ni ke man ke je a ron ke man ya je ken ki ta ke da jo be be ta ho ne a do sa do ya at e hi be che ata ke e yo o ne o yeni jo e ti ho ni a jo be ken o ti jo hat a e kodon Nakasquidon Hizani ot ayen hitchik adult kinde ko eshin ba ako sendo ba ako. Again, I'd like to thank all the listeners for tuning into our weekly town hall. Again, there's a lot of education. Just because our United States says the pandemic is over, we're taking additional precautionary measures within our Navajo Nation. We would like for you to continue to wear your mask indoors. Outdoors, you can take it off as long as you keep the social distancing. We want you to continue to practice the 3 W's, wash your hands. You know, those are some of the things, use your hand sanitizers. And then most importantly, my fellow listeners, to have respect for one another and to share positive thoughts and positive feelings. Once I understand social media can be negative, but negativity will not get us anywhere. Being negative only hurts you. If you're sharing negative comments, negative thoughts, negative feelings, our grandparents used to say, when you speak negative or when you have negative thoughts, negative feeling, you're not hurting the people that you're saying it to. You're hurting yourself. You're hurting the ones you love the most. You're hurting your animals, your livestock, your well being. And it's you that's putting yourself in that situation. So be positive, everybody. Have positive thoughts, positive feelings, so good things can come to you. You know, so good things can come to you, to my people. Kohot ashin kodo ihe nan hitesh nido lesh kedo shidne yo dan hini nido hajo sad yat ebe chi adatke nasko ne ne be hena el hena da iltido enitzen kon sagoshin hich hanana si dole dona ihe jonon he da do ahto ado da da hosia ihe